Make sure you hit that like button and subscribe to keep those healthy insights coming your way. Today, we're diving into a topic that might be a little sensitive for some, but it's incredibly important for a lot of people.
Yeah.
We're talking about erectile dysfunction, or ED, and the surprising role that some common medications can play. You know, you hear about ED in those ads on late-night TV, but what you might not realize is that it affects a huge percentage of men.
Yeah.
We're talking at least half of men over 40.
Wow.
And by the time men reach their 70s and 80s, that number jumps to a staggering 80%.
Yeah, that's right. And what's even more fascinating is that in a significant number of these cases, the underlying cause might actually be medication. It's estimated that up to 20% of ED cases are linked to medications that people are taking for completely unrelated conditions.
Wow, 20%. That's a pretty big chunk. So if you're out there and dealing with ED, you might not need to resign yourself to thinking it's just a natural part of aging. Instead, it could be something you're taking that's silently sabotaging things, so to speak.
Exactly. And that's why it's so crucial to have a really honest conversation with your doctor about your entire medication history. You know, sometimes side effects can sneak up on you, even if you've been taking a medication for years without any issues.
Okay, so let's get into the nitty-gritty here. What are some of these sneaky medications that we should be aware of?
Well, it really runs the gamut from blood pressure meds to antidepressants, anxiety medications, and even some over-the-counter remedies. It's pretty eye-opening.
Okay, so no medication is off the hook then.
Right.
Hit me with some specifics. What should people be looking out for?
Let's start with antihypertensives, which are those everyday medications prescribed for high blood pressure. A common one you might recognize is hydrochlorothiazide, or HCTZ for short. It's often a first-line treatment for high blood pressure, but studies have shown that it can increase the likelihood of ED by 2 to 6 times.
Whoa, 2 to 6 times. That's a significant jump.
Right.
Are there other blood pressure medications that fall into this category?
Yes, definitely. Beta blockers, which are also commonly prescribed for high blood pressure, can have similar effects. Medications like propranolol and atenolol, for example, have been linked to not just difficulty achieving erections, but they can also impact arousal and orgasm.
So it's not just about getting an erection, it's impacting the whole experience then.
Exactly. It's like they're throwing a wrench into the whole system.
Okay, so if you're on blood pressure medication and things aren't quite working the way they used to, this could be a potential culprit. What about other common medications like antidepressants?
Antidepressants are definitely another category to be aware of. Specifically, SSRIs, or selective serotonin reuptake inhibitors, are often linked to ED. These are medications like fluoxetine, Prozac, duloxetine, Cymbalta, and paroxetine Paxil. And if you've been taking some of the older types of antidepressants for a long time, there's also a potential for developing chronic ED.
This is interesting because antidepressants are obviously so important for many people managing mental health conditions. But it sounds like there's a potential trade-off here.
That's right. It's a delicate balance. And mental health is paramount, of course, but it's also important to consider the potential impact on other aspects of your health, including sexual function. The good news is that there are often alternative medications or approaches that can be just as effective for managing your mental health without those unwanted side effects.
So it's not a one-size-fits-all situation. What should someone do if they're taking an antidepressant and experiencing these side effects?
The most important thing is to talk to your psychiatrist.
Yeah.
Don't suffer in silence. There might be alternative medications that could be just as effective without the same impact on your sexual health.
So it's all about having that open communication with your doctor and advocating for your own well-being. What about anxiety medications? Are those on the list of potential culprits as well?
Yes, definitely. Anxiolytics, which are medications used to treat anxiety, can also have an impact on sexual function. Even small doses of commonly prescribed medications like clonazepam, Klonopin, alprazolamide, Xanax, and lorazepam, Ativan, including the well-known Rivotril drops, can contribute to a reduced libido and difficulty achieving erections.
It's amazing how even seemingly small doses of these medications can have such noticeable effects. What other medications should we be aware of?
Oh, gosh.
I know this might be a tough question to answer because there are so many different medications out there.
It's true. There's a long list, but let's touch on a few more key categories. For patients living with HIV, long-term use of antiretrovirals, particularly AZT, has been linked to sexual dysfunction. This makes sense considering the impact HIV itself can have on the body.
Yeah, that's understandable. It seems like any medication that affects the immune system or hormones could potentially have these ripple effects.
Exactly. And then you have rheumatological medications, which are used to treat conditions like rheumatoid arthritis. Methotrexate, a common medication in this category, can also contribute to ED.
It's really striking how many different medications can potentially impact sexual function. It really underscores the importance of that open dialogue with your doctor, like you were saying earlier.
I couldn't agree more. It's your health, and you have the right to be informed about all the potential risks and benefits of any medication you're taking. Don't be afraid to ask questions.
Right. Knowledge is power. Speaking of medications with potential side effects, what about opioids? I know they're often prescribed for pain management, but I've also heard whispers about their impact on sexual health.
Opioids are definitely a category to be cautious with. While they're necessary for pain management in certain situations, medications like morphine and nalbuphine can have a significant negative impact on sexual function. And of course, there are the risks of dependency and addiction that come with opioid use, which is a whole other conversation in itself.
Yeah, opioids are a whole other can of worms, so to speak. What about antipsychotics? Do they fall into this category as well?
Yes, they do. Antipsychotics are also on the list of medications that can potentially lead to ED impacting overall sexual health.
It seems like the list just keeps going on. Are there any other surprises in store?
Well, here's something that might surprise you. Even some over-the-counter medications can play a role in ED.
Really? I wouldn't have guessed that. What kind of over-the-counter medications are we talking about?
It's true. Older antihistamines like promethazine, often known as Phenergan, and some older antacids like ranitidine have been associated with ED. Ranitidine isn't used as frequently now, having been largely replaced by proton pump inhibitors like omeprazole, but it's still out there. It just goes to show that even medications that seem harmless can have these unexpected side effects.
So even if you're not taking any prescription medications, it's still worth being aware of the potential impact of over-the-counter remedies. This is all incredibly eye-opening. I'm sure our listeners are soaking this all in. We'll be back in a moment to continue our deep dive into the fascinating link between medication and ED. Stay tuned.
Welcome back, everyone. I imagine you might be curious about the how behind all of this. How do these everyday medications actually affect erectile function? It seems a bit counterintuitive, right?
Absolutely. I mean, we know certain medications can cause ED, but what's the actual mechanism behind it? What's going on inside the body to cause this?
Well, it's pretty fascinating, actually. Think of it like this. Achieving and maintaining an erection requires a delicate interplay of several different systems in your body. We're talking about nerves, blood vessels, hormones, and of course your psychological state all working together in perfect harmony. Medications can sometimes disrupt this intricate dance in a variety of ways.
Okay, I'm picturing a beautifully choreographed ballet happening in my body right now, and these medications are coming in and tripping up the dancers.
I love that analogy. It's a great way to visualize it. So let's take those antihypertensives we talked about earlier, like thiazides. One of the ways they work is by actually decreasing blood flow to the penis. And as you can imagine, having sufficient blood flow to that area is absolutely crucial for achieving an erection.
Ah, that makes perfect sense. So if the medication is constricting blood vessels, it's going to make it harder to get blood where it needs to go.
Precisely. And then you have beta blockers, which work in a slightly different way. They can interfere with nerve signals that are essential for arousal and erections. They can also mess with hormone levels like testosterone, which plays a key role in sexual function.
So it's like a multi-pronged attack on our poor little ballet there.
Oh.
It's no wonder things can go wrong.
Yeah.
What about antidepressants? How do those affect things?
With antidepressants, specifically SSRIs, things get a little more complex. Their primary function is to increase serotonin levels in the brain, which is great for mood regulation. But here's the catch. Serotonin also plays a role in sexual function, and too much of it can actually have an inhibitory effect.
Wait, so too much of a good thing can be a bad thing in this case. That's interesting. Isn't serotonin supposed to be the happy hormone? How can too much of it cause problems in the bedroom?
It's all about balance, really. Serotonin plays a multifaceted role in our bodies, and while increasing levels can be incredibly helpful for mood disorders, it can also tip the scales in the other direction when it comes to sexual function. It's like finding that sweet spot, which can be tricky.
So it's not as simple as more serotonin equals happier and healthier. There's a lot more nuance to it. It highlights why working closely with your doctor to find the right medication and dosage for your individual needs is so crucial.
Absolutely. What works for one person might not work for another. And even if a medication has worked well for you in the past, changes in your body or other medications you're taking can shift that balance. It's an ongoing conversation you need to have with your healthcare provider.
Okay, so we've covered Antihypertensives and antidepressants. What about anxiety medications, those anxiolytics we were talking about earlier? How do they fit into all of this?
Anxiolytics can also throw a wrench into the works, so to speak. They tend to have a dampening effect on libido, which obviously makes it harder to get in the mood in the first place.
Right, that makes sense. If your mind isn't in the game, it's going to be tough to get your body on board too.
Exactly. And then you have medications like antiretrovirals and rheumatological drugs. These can have a more direct impact on the physical aspects of sexual function. They can affect hormone levels, damage nerves that are important for sensation and arousal, and impact blood flow, all of which can contribute to ED.
So it's like a domino effect. One thing gets disrupted, and it sets off a chain reaction throughout the whole system.
That's a great way to put it. And then, of course, we have opioids, which we touched on earlier. These are notorious for suppressing testosterone production, which is, as we've discussed, a key player in healthy sexual function.
Okay, so if we go back to our ballet analogy, opioids are like the big, clumsy stagehands who accidentally knock over the scenery and disrupt the entire performance.
You got it. And finally, let's not forget about those seemingly harmless over-the-counter medications we mentioned, like certain antihistamines and antacids. They can sometimes block a chemical called histamine, which, believe it or not, is also involved in the process of achieving an erection.
Wow. So even those medications that you pick up at the drugstore without a second thought can potentially interfere with things. It's amazing how interconnected everything is within the body.
It really is. And it just goes to show that even though we often think of medications as targeting specific issues, there can be these unintended consequences in other areas of our health.
This has been incredibly insightful. I'm starting to understand just how complex and delicate the balance is within the body, and how even small disruptions can have a big impact. We'll be back in a moment to wrap things up and talk about what you can do if you're experiencing ED and suspect a medication might be playing a role. Don't go anywhere. All right, we're back. And I have to say, learning about all these medications and their potential impact on sexual health has been quite the journey. It really makes you think twice about what you're putting into your body, right?
It definitely highlights the importance of being an informed patient and understanding the potential risks and benefits of any medication you're taking.
Exactly. So let's do a quick recap for our listeners who might have missed a few things. We've learned that a surprisingly large percentage of ED cases are actually related to medications, and these culprits can range from those everyday blood pressure meds to antidepressants, anxiety meds, and even those seemingly harmless over-the-counter remedies. It's amazing how something you're taking for one issue can have these unintended consequences in a completely different area of your health.
It really underscores the interconnectedness of our bodily systems, doesn't it? And we explored how these medications can interfere with that intricate dance of nerves, blood vessels, and hormones that are essential for achieving and maintaining an erection.
Right. It's like they're throwing a wrench into the works, sabotaging your date night, so to speak.
Mm-hmm.
But here's the good news. It's not a hopeless situation. There are often solutions and alternatives out there.
Absolutely. If you're experiencing ED and suspect a medication might be contributing, the most important thing is to talk to your doctor. Don't just brush it off or assume it's something you have to live with.
Right. Don't suffer in silence. But what can a doctor actually do in this situation? Are there alternatives to these medications?
There are often a few different options depending on your individual circumstances and the specific medication that might be causing the issue. In some cases, switching to a different medication within the same class might do the trick. For example, if a certain type of blood pressure medication is causing problems, there might be another type that's equally effective for managing your blood pressure but doesn't have those unwanted sexual side effects.
So it's about finding the right fit for your unique situation.
Precisely. In other cases, adjusting the dosage of your current medication might be a possibility. Sometimes a lower dose can still be effective for managing the underlying condition while minimizing the side effects.
That makes sense. But what if adjusting the medication isn't an option? What if someone needs to be on a particular medication for a serious health condition, but it's causing these unwanted sexual side effects? Are they just stuck?
Not necessarily. There are other approaches that can be helpful. Sometimes lifestyle changes can make a big difference. Things like regular exercise, a healthy diet, managing stress, and getting enough sleep can all contribute to better overall health, including sexual health. And of course, open communication with your partner is crucial. Talking about what you're experiencing and working together to find solutions can help strengthen your relationship and reduce any anxiety or stress that might be contributing to the issue.
So it's a holistic approach addressing both the physical and the emotional aspects of the situation.
Exactly. And in some cases, your doctor might recommend specific therapies or treatments to address the ED directly, regardless of the underlying cause. The key takeaway here is that there are options, and it's worth exploring those options with your healthcare provider.
This has been a truly enlightening deep dive. I feel like I've learned so much about a topic that isn't often discussed openly. So if we can leave our listeners with one key message, what would it be?
I think the most important message is this. If you're experiencing ED, don't just assume it's an inevitable part of aging or something you have to accept. It could be related to a medication you're taking, and there might be solutions out there that can help you regain control of your sexual health and enjoy a fulfilling life.
That's a great message to end on. Remember, knowledge is power. And taking charge of your health starts with asking questions and having those sometimes uncomfortable conversations with your doctor. You deserve to live a happy and healthy life, and that includes a healthy sex life. If you found this deep dive helpful, please share it with anyone who might benefit from this information. And as always, thanks for tuning in to HealthyCast. We'll catch you next time with another fascinating exploration of health and wellness.